Good afternoon, everyone. Welcome. I'm Lisa Brown, Chancellor of WSU Spokane. It's great to see you here on a beautiful afternoon. And I see a lot of people who are partners and friends of this campus, which, by the way, is celebrating its 25th anniversary next week right here on Thursday evening from 5 to 7, and you're all welcome to be part of that. But I can see many of you here in the community who have been part of that over the last 25 years. I will probably miss some, but let me just acknowledge some of our community partners and friends who are here with us today to hear the news about our feasibility study, hear from our president, the chair of our board, and some of our community supporters. So, in no particular order, but just the order I saw you in, I see we have friends here from Eastern Washington University. We share the campus with them from the University of Washington, whose programs are also here, health sciences programs across the spectrum, from physician assistants, WWAMI, dental and dental hygiene, occupational and physical therapy, nutrition, exercise, physiology, and of course, our own WSU colleges of nursing, pharmacy, and medical sciences. Empire Health Foundation, I see friends from the public schools, from Pacific Northwest University, thank you for coming from Yakima to be here. Obviously our healthcare partners, Providence, who has joined with us and soon to be forming a new community clinic that will house medical residents on our campus, along in that consortium with Empire Health Foundation. See friends from St. Luke's, INHS, the City of Spokane, Civic Leaders, GSI, McKinstry right down the road, United Way, many healthcare professionals, physicians, nurses, and others, and Representative Marcus Riccelli from the 3rd District. Thank you, Marcus, for being here. So I may have missed some of you, but I just want to say thank you so much for the support you've given us and the inspiration to be on this path to meet the very significant and growing healthcare needs of the population, as well as being a place where students have the opportunity to become the healthcare providers of the future, and where cutting-edge research is happening right above us here in the 3 floors above us. We're very proud of your support also for this amazing facility that we have. It could not have happened without the support of the people in Spokane. So it's my great pleasure to move us on in our program today by welcoming our 10th president of Washington State University, a man who had parts of his early career here in Eastern Washington with Eastern Washington University, went on to direct the Higher Education Coordinating Board and to have a distinguished career as president of other universities around the country, returning here to lead Washington State University, Dr. Elson Floyd.
Well, Chancellor Brown, thank you very much for the introduction, and thank each and every one of you for being a part of this briefing this afternoon. I need to tell you that prior to beginning this conversation about medical education here in Spokane, I had much more hair than I have now. So hopefully it'll come back as things begin to settle. Let me start by sharing with you a little bit about my background, because my background really does inform where we are now. When I returned to Washington State University some 7 years ago, it was abundantly clear to me that we could not be all things to all people, and we had to focus our urban campuses around the economic development needs of the communities in which we found ourselves. So we then began to think strategically about what we were going to do in the context of all of our branch campuses. You see, a little bit over 20 years ago, I had the great pleasure of serving as a vice president at Eastern Washington University, and then I moved on from there to the executive director of the Higher Education Coordinating Board. And from there, I returned to my alma mater, the University of North Carolina, which has one of the leading schools of medicine in the country. And I served as the executive vice chancellor there. And then I went into my first presidency at Western Michigan University, and in fact, Western Michigan University is one of the institutions in the state of Michigan that's establishing its own school of medicine. And I was very proud to have been part of some of the foundation that laid that initiative in place. And from there, I became president of the University of Missouri system, where we had 2 schools of medicine and a hospital to boot. And so when I arrived here, we began to focus on the economic development issues in each of the communities in a very strategic way. Here in Spokane, we wanted to focus on the health sciences. It's very logical for us to do that. When you think of the strength of the hospital system and the focus that you have on the health sciences, it's a no-brainer that we should indeed be engaged in that. Non-health science related programs, we relocated from Spokane mostly to Pullman. A few programs went to some of our other campuses, but primarily to Pullman. At the same time, the health-related programs that we had in Pullman, with the exception of vet med, we began to relocate here. And in fact, we have a vet med clinic here on this campus as well. And the most significant movement in that regard was the College of Pharmacy. So we've moved our College of Pharmacy in its entirety from Pullman to here to Spokane. And this building houses our College of Pharmacy. We also wanted to be very strategic about the investments we asked the legislature to make into the institution. And so this building cost a little bit beyond $60 million. Half of the cost of this building was borne by the state, and the other half by Washington State University. And so we've been a significant investor, not only in this building, but as you look at this campus. And we have been, as I said before, strategically focused around the health sciences. So last spring, I had the occasion to visit with my counterpart, President Mike Young, at the University of Washington, and I shared with him the fact that we were going to engage in a feasibility study. And I enlisted his assistance and help, as well as his colleagues, with the data gathering aspect associated with it. He agreed that they would indeed participate in the feasibility study, and for that I was most grateful. The following month, he asked me to forward to him names of 2 of my regents to serve on a group chaired by former Governor Dan Evans to look at the WWAMI program. And I was glad to recommend 2 of my regents to serve in that capacity. So it was during this period of time that we engaged MGT of America, and many of you are familiar with MGT because they've done quite a bit of work here in this space, and they've done a lot of work in the context of medical education. And we asked them to conduct a feasibility study around WSU's readiness to establish a College of Medicine here in Spokane. And we will hear from the consultants in just a few moments regarding their conclusions and findings. But as we have analyzed where the consultants have been and what the needs are within our state, it's abundantly clear to us that we need to continue to pursue an independent, state-supported medical school, the second one in our state, and the third medical school that we have within the state of Washington. And that's an important defining moment for our state. And the reason is very simple. There is a dire need for Washingtonians to have access to high-quality health care. There's a dire need. And there are 4 compelling reasons. One is the growth of this population. Secondly is the graying of this population, and I'm proof positive of that. And the other is the fact that we have a number of primary care docs who are retiring. And then the 4th, very compelling issue is the Affordable Care Act, and the fact that it is really built on this foundation of having primary care docs. So when you consider all of those things, this is not a debate between Washington State University and the University of Washington. It's about how do we serve the healthcare needs of Washingtonians first and foremost, and especially those in Eastern Washington and underserved areas of our state. And that is what this conversation is all about, and that is what the feasibility report is about. I report to a Board of Regents, and I have a great pleasure of introducing to you Mike Worthy, who serves as the chair of the Board of Regents for Washington State University. Chairman Worthy.
Thank you, Dr. Floyd. I want to take just a few moments on behalf of the Board of Regents to thank you for being here and your interest in medical education in Spokane. One of our primary responsibilities as a board is to examine the activities and academic programs throughout the state in the context of the land grant mission that is defined for Washington State University. And so we are constantly talking about how we can deliver on the needs of the citizens of Washington and still meet all the other demands that the university faces. So in the discussion around medical education and health sciences, we had made strategic decisions in recent years to focus, as Dr. Floyd said, our health sciences activities and programs here in Spokane. And I have the great pleasure of being my 7th year as a regent, and I've been present for the majority of the authorization of fundings for the buildings and facilities that you see here in Spokane. And each time we're challenged with a proposal to build infrastructure for health sciences in Spokane, we have to deliberate over the return on those investments and the readiness of WSU and our state to fund facilities for academic pursuits such as this one. So we knew from the years that we've been investing in Spokane of the significant investments we had made here. And they are in excess of $200 million invested on this campus in recent years in support of our programs directing toward health sciences. So when the discussion began about the possibility of a WSU College of Medicine here in Spokane, we said, you know, we're going to need to have the same kind of supporting analysis and rigor that we always ask for when we spend money on other things. And you know, yeah, that would be a significant endeavor, so let's talk about it, let's find out more about it, which led, in fact, to Dr. Floyd's commissioning of MGT of America to execute on a feasibility study. At the same time, for 40 years, Washington State University has been a partner in the WWAMI program. It's University of Washington's distributed education medical program. We're very proud of those affiliations. We have excellent faculty of WSU that are engaged in teaching medical students here in Spokane. We knew about WWAMI, of course, and we've been a good and stable partner for University of Washington in all of those years. So knowing about WWAMI and knowing about our giant investment in Spokane, we were anxious to see what the potential and responsibility, frankly, of WSU might look like in establishing a School of Medicine here in Spokane. So along the way, and you heard Dr. Floyd refer to the meeting in March when he met with President Mike Young at the University of Washington, and we have continued a conversation with the University of Washington. I know there's sometimes dramatic reporting around those events, but President Floyd and I have met with our counterparts at University of Washington on several occasions. We continue to be in those conversations, and despite what you often read, they are cordial and active and constructive conversations. But as those conversations continued throughout the summer, and I was closing in on a board meeting with my board to talk about medical education, I said, you know, I really think we need to see some very quantifiable data from the feasibility study before we try to determine how WSU should move forward. So in the recent weeks, we've received the final and detailed reports from MGT of America. And when I made a presentation last Thursday in concert with the consultants, Dr. Floyd, and the others involved here in Spokane in advancing our medical education programs, that information was extremely compelling. And you're going to hear about it today, but I can tell you to the extent as chairman of a board that I had responsibility to inform my board about the opportunities and risks associated with our decisions, by the time we were finished reviewing this data and considering the dialogue around it, it was absolutely and overwhelmingly unanimous that Washington State University needed to pursue an accredited College of Medicine in Spokane. There was no doubt, and in fact, it was as powerful a charge as I've ever heard our board give to our president. The next thing that we said is, in no way would we want the School or College of Medicine in Spokane to impact our partnership in WWAMI. And the resolution our board adopted last Friday directed the president to proceed to establish a College of Medicine and to continue our partnership with WWAMI programs in collaboration with the University of Washington. And we emphasized that several times. And the reason is, as you will hear today, the need for physicians in Washington State is so pronounced, it will take the investments of both state universities and many others to even come close to what our needs will be for physicians in Washington in the future. So I'm delighted to say that I've had a great opportunity to work with the professionals from MGT over the last 2 weeks. I've had the opportunity to ask them the range of questions that both a board member or citizen would have occasion to ask. And I can tell you I'm extremely proud to bring this data before you in detail. And I'd like to introduce now, if I may, the team from MGT of America. And Ray, would you please join me and lead that discussion?
Thank you. It's a pleasure for MGT, my team, senior team members here to be able to share the results of the feasibility study with you today. I think it's important, and as we start this out, we're engaged in this about in the early spring, as Dr. Floyd had mentioned. And we came into this looking at there's a pronounced and certainly an acknowledged need for physicians across the country. That's not been debated. And we wondered, okay, I'm sure that's probably the same case here in Washington State. But we were not sure of the details and certainly not sure of the magnitude of that. And so this part of the process was going through that very beginning of looking at the need. So there were 4 questions or charges that we were given as part of the feasibility study. The first one was to determine if there was a need for physicians and get into the detail of that need if possible. The second one was, if there is a need, then what type of medical education model might be the best to meet that particular set of needs? And finally, 2 other items that were very important. As you go through the process of seeking and establishing a medical school, you must deal with the Liaison Committee on Medical Education, or LCME, and their accreditation standards. And so we wanted to look at at WSU, and certainly the WSU Spokane campus, and look and see if you wanted to pursue a medical school at this particular campus and through the university, what assets and how ready you are to meet some of those 12 standards. And we'll talk about that in just a few minutes. But certainly that's a big component of that. And then finally, the last piece of this particular feasibility study was the financial and time constraints on that. If you were to pursue a medical school, how quickly could that happen? How quickly could you get to? There are 3 types of accreditation. There's a preliminary accreditation, of which you cannot advertise or recruit students until you receive that particular designation and authorization from LCME. The next piece of that is to become a provisional accreditation, and finally you get full accreditation and proceed with all the assets and advantages and opportunities of a medical school. And so how could that happen? What position was WSU in at this point in time to pursue that type of accreditation process? How long would it take before you seat your first class? And how long would it be before you graduated the first class to add to that the resolve of the problem of adding more physicians to the state? And finally, the last piece to that is how much is it going to cost? The financial aspects of how do you develop that process through a multi-year period to get to where you would like to be so that you're contributing to the solution to this problem. And so I'll start out with this particular piece about the need, and then I would like to bring up one of my colleagues here to talk a little bit more about that accreditation process, the readiness of the campus and the university for this process. So one of the interesting things we found, and I will state this up front, we found a more compelling need than we ever dreamed of in this particular case. And we've done a number of these studies around the country over the years, and this one was a very interesting and certainly a very compelling component of the need. First of all, the state as a whole, when you look at the number of physicians, and particularly patient care and primary care physicians, it's a reasonably number compared to the national average that you see out there. When we started to delve a little deeper into that, we found that there's really a disproportionate distribution of physicians around the state. One of the things that we noted, and this is not to be unexpected, I don't think, but that of the King County in Seattle, 29% of the population lives in that county of the state. Nearly 50%, 48% of the doctors reside in that county. We also found that, and we looked at it on a county-by-county basis, that there are, I think, 17 or 18 of the 39 counties have less than 10 physicians per 10,000 population. And all but 4 counties exceed the national average of physician per population of about 24 physicians for every 10,000 population. And those are King, Spokane, Walla Walla, and Chelan. Every other county is below that particular number. And so that was a compelling interest, and certainly the distribution of that was compelling. So there's really no argument, and certainly national data states this as well, that there is a need for additional physicians in the years. President Floyd talked about several factors: the growing population, the aging population. As we all grow older, we all need to see the doctor more often and usually have more creaks and serious problems as we go forward. The other piece to that is the Affordable Care Act, and from what I've understood over monitoring that situation over the last 6 months as we've been looking at this, your state is ahead of any projections that they were talking about, and a time frame that you're talking about in terms of the impact of that particular legislation. And so that's putting more demand on the existing physician population and workforce that you have out there. And it's across the state, and certainly not only in rural areas where there's a lack of doctors per capita, but certainly even in urban areas where there are underserved populations that were not getting the particular medical care in that system, that type of system. So those were some compelling issues for developing the idea that there is a need out there, our first question. The other question was that the need is not just necessarily total doctors across the state and primary care doctors across the state, but certainly where they're located and how the access to those doctors is distributed unevenly across the state. The other factor that we looked at in terms of the need was, obviously, to solve that particular, or at least to attempt to solve that particular need, you need to have access to medical school. And certainly the access, and this, we're talking predominantly about the public access, public medical school access. The University of Washington's been doing a fantastic job. They have the WWAMI program in place for 40 plus years. They're serving a 5-state region in that particular piece. But there's only 120 seats that are typically available for Washington residents. And a couple of interesting data points that we found in the 12, I think it's the 12-13, or I think it's the 12-13 academic year. There was 340 residents of Washington that were accepted into medical school in any location in the United States, in an LCME accredited medical school. Only 120 got into the University of Washington. 2/3 of those numbers had to go out of state. So there's a couple of factors there that are correlated to that. One is that's typically going out to either a public or a private institution out of state. There's more cost involved in that, which therefore creates more debt, and certainly that's a big issue in terms of medical school students getting out and having a tremendous amount of debt that they have to relieve at some point during their careers. The second piece to that is it's a known fact that as you, where you do your undergraduate medical education, and certainly where you do your graduate medical residencies, there is a correlation there about where you practice in the future. And so some of those people who leave do not come back. I think there's some statistics that we found in the physician population that basically said that if a Washington, current doctors who are practicing in Washington, if they did their undergraduate medical education in the state, there's about a 45% chance that they would be practicing back in the state at this point in time. And those are for doctors that are out there now practicing in the state. For those who did their graduate residency programs in state, that jumps up to about 49%. What was remarkable, and it's a smaller sample, obviously, but when we looked at the data for those who did both undergraduate and graduate residency programs within the state, that retention number or return number jumps up into close to 70%. And that gets those folks back here to serve the local areas where they came from in the first place. So with that data and the need there, the other piece to that access is the graduate residency programming. And the slots, the first year slots, I think there's roughly 400, 450, and looking at my colleagues to shake yes or no with the exact number, but over 400 slots available for matching for the first year residency requirements here in the state. About 85% of those are again in the Seattle-Tacoma metropolitan area. Only 11% of those slots are really east of the Cascades. So again, a distribution of educational opportunities and training opportunities make it harder for folks to serve those other areas that we've just noted in the previous statements about how the demand and the need for physicians are. So there's a whole compelling set of data that's out there that talks about the need that's distributed across the state of Washington as well. So what the next piece was, if we identified that need, and there's far more detail than this in the report, because you can take a look at it at some point in time. But the idea was, so what kind of model would address this? What kind of model would provide educational opportunities that will get folks to come back and be out in those communities that don't have those doctors or don't have the right level of doctors? What kind of model of medical education would get out to those underserved populations across the state, even in those urban areas? And I think one of the questions that came up early on, and I'll bring up my colleague in just a minute to talk about this model, but it's really a community-based, a distributed model, but it's a community-based model that places those students, and particularly in the residency fields, out in those locations. And it also addresses the idea of targeting the admissions process to find folks who are at least likened to come to those areas. We find that in a lot of different programs beyond medical education in terms of attracting folks to get into the workforce into areas where it's not as desirable or not as financially advantaged to practice in whatever their profession is. And medical education, with all the depth that you have from your years in training and education, is a problem. So that's part of the issue. What I'd like to do now, I guess, is introduce my colleague. This is Dr. Myra Hart. We've been kidding her about her name's been changed several times in the media for the last 2 days. So Dr. Myra Hurt is the Senior Associate Dean of the College of Medicine at Florida State University, and they were the first in a long time to introduce this model into a new paradigm for medical education. And she's going to talk a little bit about that and the readiness that they see of the university in terms of pursuing this. So Myra, please come up.
Yes, for anybody that cares, it's hurt as in pain. Good to see everyone. This is a beautiful city, beautiful weather. Glad to be up here with lower humidity. And I got to tell you, I think I could live here actually. I'm not looking for a job though, I'm a little past that. So I'm here to tell you that there is a path that you could follow. It is our path that we've gone through. We were in the turn of the 20th century, right where you are. We were a program, a whammy-like program with the University of Florida. I was director of that program, the program in medical sciences. We had 30 students on the campus of Florida State that went to the University of Florida to complete their clinical training. We decided, I won't bore you with epiphanies and so forth, but there was a great need in Florida. We are a rural state also, just like Washington. Over 60% of the people live in rural areas. That doesn't make sense with what you see on the ads, come visit Florida, but that's really the truth. And so, how do you get students to go out into the rural areas? Now, the people trained in the previous 20th century paradigm, is what I like to call it, cannot imagine how this is possible. It is a difficult issue. It's not easy, but we started during the PIMS years, reaching back into middle school and creating a pipeline all the way to medical school. for students from our target underserved communities. In Florida, that's African Americans, Hispanics, and rural kids. We're in 5 counties of Florida now. 2 of those counties are actually paying for our program. We have intensive science reading, I always call it reading, writing, and arithmetic because I'm a 20th century gal, and actually early-ish 20th century. Anyway, we give them role modeling experiences, etc. High school, all the way in college. There's a college component to support these kids as they transition into college and make sure that they do well in their pre-medical sciences and so forth. And then the last piece, I missed, we have an honors medical scholars program also that picks the brightest kids from the honors program at Florida State and converts them to primary care. So far, there are 2/3 of them are going into primary care, where I believe in another setting they would have been oncologists or dermatologists or something, and there's nothing wrong with that. I know several. Anyway, the last piece of our pipeline is the Bridge program, which takes students from our target populations from the actual medical applicant pool, puts them through a year program with some in classes with the medical students, others preparing them for standardized test taking, etc. And the percentage at this point graduating from medical school is 96%. To get into the weeds just for a moment, Ray took most of my time. I will say that our training model is completely different from the PIMS or the WHAMI model in that our students do 2 years, the preclinical years, at Florida State University, and then by a lottery, they select one of our 6 distant campuses, one of which is not so distant. It's across Tallahassee, but the rest are around the state of Florida. We train our students utilizing community physicians in existing healthcare facilities. We've recruited 2,300 physicians from those communities. They're vetted by a community board and a campus dean who's from that community and has a distinguished reputation. And our students are assigned in that community on their clerkships, say pediatrics, to a pediatric physician. And they see patients with that physician in all the settings that they practice. I won't go into the details, but we connect digitally to make sure that each student is getting all the experiences that they need. They take shelf boards, etc. To give you the bottom line, we've graduated 700 students. About 200 of them are out of the training pipeline, which is long, and 60% of them are practicing in Florida, even if they had to go out of state to train. 64% of them are in primary care, and 20% of them are practicing in rural settings. We're extremely positive, is the word I'll say, that you could do this training model in Washington, if that's what you choose, because you're way more ready for this journey than we were when we started. You have way more assets. You have this brand new building. You have the pharmacy, nursing, etc. arrayed around you. You have faculty. All of these assets that have been invested over the last 25 years give you a giant step in terms of admitting medical students to train here at this university. In terms of readiness to get into the accreditation pipeline, we believe it is very doable. And how do I know this? I was a member of the new and developing medical schools of the 16 schools that are somewhere in the accreditation pipeline over the last several years, 6 of which are fully accredited. I was chair, actually, of that group for a year. You are way ahead. You could potentially admit medical students here in the fall of 2017, simply because you're about halfway in terms of addressing all of the accreditation standards. It will be, I'm not saying it'll be an easy journey, and I will say this, the politics of this situation is not unusual. I lived through this with the University of Florida there is life after the firestorm, and actually we now collaborate on research and so forth. So I haven't told you the bottom line cost, but we imagine, based on several new schools, including the 4 new schools in Florida, that you are about halfway to the complete budget that you would need 10 years from now, which is about $24 million is what would be needed to have this medical school with 480 students in years 1 through 4. That's a very, very economical choice for this state to address a very dire need. I think I'll leave it there.
Thanks very much. Dr. Greer, thank you very much. Let me just sort of summarize the financial piece very quickly. We would look for an initial investment of $2.5 million from the legislature. That would become our legislative request in the upcoming session. $24 million would be necessary for full build-out. That compares to roughly $94 million that's allocated to the University of Washington on an annual basis. It is also important to note that there will be no additional capital request in this regard. So those are the financial numbers. It's my great pleasure now to ask Dr. Jeremy Graham to please come forward. Dr. Graham.
Thank you to Dr. Floyd, and thanks for hearing me for a few moments. The reason I get to be here and share a few words is to bring a few words from the Alliance of Teaching Physicians. And I should explain to you briefly what that is. It's a group I'm part of, and it's a number of doctors, much bigger than just me. It's a group of ad hoc physicians who came together over the past couple of years, all volunteer, all unfunded. All of us are teaching physicians, and we've advocated for a new school of medicine in this state for years. In the case of a couple of our physicians for decades, I think reaching back longer than WSU Spokane has been here. A couple of years ago, I think probably about January 2013, we realized we needed to coalesce together and became the Alliance of Teaching Physicians. And we've been writing to the governor, meeting with legislators, actually writing to Dr. Floyd and Lisa Brown, urging a new school of medicine for this state, and specifically a school of community medicine is what we've been talking about more and more. So today's really a heartening moment for teaching physicians, and we have a message of largely gratitude, but also some promise for the future. We really have to thank WSU Spokane for a vision of a new medical school that can really help encompass the entire state's needs for new physicians. The whole state needs a new school of medicine. We have some thanks also to Pacific Northwest University down in Yakima for doing yeoman's work, making a dent in the needs that we have. It's going to be a wonderful new partnership down the road in the future. And there's two things that teaching physicians see all the time that we want to share. That's the reason that we've done this. One is that Washington State doesn't train enough of its own physicians. We import something like 4 out of 5 of our physicians in this state. It's great to work with people from places like Missouri and UCLA and Australia, but this is not necessarily a local pipeline that you can depend on as easily as we might hope. While we import about 85% of our doctors, we turn away from our state about 250 or so students who leave to get into a top flight medical school. And it's very bittersweet to be a guy who writes a letter of recommendation for a student and watch them get into a fantastic school, but super far away, and they never come back. All right, good for them, bad for our state. They pay top out-of-state prices too, go into debt, and that's a big barrier to primary care. This is a model that we're living with that isn't bringing physicians to our state the way we need. What we've needed is exactly a new school. Housed here at WSU Spokane is the optimal place for it to be, and really building on community-based medical education. This is different from anything we've seen in this state before. This is a 21st century model that Dr. Hurt talked about briefly, but let me tell you how this aligns with what we need to do here. Community-based medical education, this is how you're going to train physicians younger and smarter than me, physicians who are trained early to work in teams, physicians who work very early with nurse practitioners, with PAs, with the team approach we're talking about for the future, not the traditional silos. We work hard to try to achieve that. A system that's built to achieve that is what we need in this state. The other is how well this aligns with the new model of residency training. People who read lots of boring journals will know about the Institute of Medicine report over the past few months, saying that we need to train our residents in community settings, places where the lion's share of real care happens in the modern age, away from some of our older institutional models. CBME is going to allow us to do that better in this state. And there's another reason that we're all in the Alliance of Teaching Physicians really excited about this, is we happen to live here. We're invested in this community. We got kids in this community. We pay taxes in this community. We were really enthused, not surprised, but very happy to see what the price tag to make this happen is going to be. We know that we have all the resources, the teaching specialties, the research facilities to make this happen. To bring it amalgamated under one roof is going to be a very cost-effective proposition to get to what we need. And so we really want to endorse this as the school we need for partnership with the needs of the whole state. We're sure that the teaching physician community is really going to offer a robust pool of teaching talent to the service of the new school, to support and teach and to advise the formation of the new school. And it's going to succeed because of something special about community-based medical education, which is a deep, deep investment, ownership even, by teaching physicians in the community. These are the people who can cultivate and bring students up into the communities that need them. So we really want to applaud WSU Spokane, and Dr. Floyd and Lisa Brown for going this road, and we want to ask that community members and really every legislator pay attention to a couple of the needs for the future. If you want to facilitate the health of Washington State, I'll give you a short list today of ways to get started. 1, give blood if you can. 2, get your flu shot. Seriously, get your flu shot. But 3rd, support the foundation of this new medical school that the state very, very much needs. Thank you for letting me talk for a moment.
Dr. Brown, thank you very much. And now we stand ready for any questions you may have. So please raise your hand. We have some roaming mics, and we'll be glad to respond to your questions.
Okay, let's all go give blood.
Yes, there's a question in the back, please.
I was just curious, would this be an MD or a DO, or has that decision been made?
Well, Pacific Northwest University is a DO school in our state. This would be an MD program.
I'm Paul Redmond, doctor, and I want to thank Washington State University for all it's done in this campus and building up and bringing your medical services to Spokane. I think it's terrific. My question has to do with the story in the morning paper about the opportunity or the effort to work with University of Washington on a joint venture that seemed to go astray. Can you tell us what happened in those negotiations?
Yes, I would be glad to tell you that. The story has not been finalized yet, although it appears that the story in the Spokesman Review was a final story. Regent Worthy and I have met with President Mike Young and Oren Smith, who is the chair of the Board of Regents at the University of Washington, on 2 occasions. We've had Scott Morris there, as well as a few others. And we talked about ways in which the 2 institutions can continue to collaborate, especially around WWAMI. Those conversations, in our judgment, have not been concluded. I think it is very, very important for the WWAMI program to continue and for Washington State University to be a partner in that regard. At the same time, look at an independent, state-supported medical school. And the reason we need both is because of the dire need associated with it. Neither one of us can do it on our own. And so we will continue to have active and meaningful conversations with the University of Washington, and our solution is to do both. And the conjunction is and not but or. And that's where we stand as an institution, and we will make every good faith effort to continue the conversation with the University of Washington. Other questions, please? Yes. Thank you.
You know, as a person that's worked very hard for Spokane in this area, I guess I'm concerned about as if we proceed the way we are, and I have an immense respect for both universities and what's happened here. How do we synergize this in a way that Spokane as a community also benefits, not just the respective campuses, but we're able to build out this campus and surrounding economic development to bring research and the commercialization opportunities that come here. And I appreciate it. It seems as the paper reports that we've gotten polarized, and as you say, it's not over. But I'd like to hear your comments.
Sure, I'd be glad to do that. The approach that we have in mind has been described previously, but let me use slightly different words. I want you to envision a spoke and a wheel. And we would then have the School of Medicine based here in Spokane, and then we would branch out to the surrounding communities. And so you would then have a clinical and residential experiences in Yakima, in Wenatchee, in Tri-Cities, in Vancouver, and in Everett. So it is a model that really does sort of extend the footprint, if you will, of medical education around the state. And if this is to become a reality, then medical students will actually have two medical experiences to choose from, quite frankly. The community-based approach, which we've put on the table, as well as the more traditional approach that the University of Washington has with its own clinic structure and its own hospital structure. All of that adds to economic growth and development, and especially around grants and contracts for the faculty that would teach medical students during year two, which you know exceedingly well. And that is what this campus is all about. And we have the great pleasure of having not only our pharmacy program here, but our nursing program and the collaborative relationships. And all of that is going to fuel the economic growth and development, not only of Spokane, but for the entire state of Washington. We simply have not realized the economic return on all of the investments that must and should be made within our state just with one medical school. And if we look at the return on the investment, for every state that's above us, and now we are 25th in terms of the economic return value, displacing Alabama most recently, and all 24 institutions above us will have at least 2 medical schools. So there is some methodology associated with it. But I can assure you that we will do everything that we can to return that economic growth to our state while providing high-quality health care. We can't do it alone, and we look forward to continuing to partner with the University of Washington. Other questions? We have a few more minutes. Well, seeing no raised hands at this point, I want to thank you all very much for being here today, but especially for your interest in healthcare and in Washington State University and where we're headed in that regard. I want to just simply put a finer point on one issue that I'd raised before. There is a tendency to talk about a conflict between two great research universities, Washington State University and the University of Washington. That is not the case here. What we are doing is trying to make sure that we provide the highest quality health care imaginable for Washingtonians throughout our entire state. And all of you know that in some of our communities, individuals will have to drive 30 to 40 minutes to even see a primary care doc. We can do better as a state in that regard, and we'll be having an active conversation with the legislature in that regard. And we also know that for a great number of you who have to see specialties, you may not be able to have immediate access even here in Spokane. And what happens then is you are then referred to Seattle. Let's bring that healthcare here. Let's make this a reality. Thank you all very much.